Weak chin, fillers or Botox? I have a weak chin that I would like to do something about. I have orange peel skin, and no Botox can help, but also think I need length. Will Botox add any length, or are fillers my only option for this? Or is my case severe enough that I would need an implant?
Thank you for your question. You submitted several photos and you have described very well in detail in your question that you have this orange peel appearance of your chin, and you're asking, in order to improve this as well as the relative projection of the chin, will Botox be good for this alone, or can you get both done with Botox or with fillers? So certainly you've asked a very, very good question about helping this area, and I can certainly give you some guidance as to how I explain this type of question when it comes up in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and enhancing the chin area is a very common concern for the patients who come to my practice. So I'm going to distinguish for you the causes of the two issues you're mostly concerned about. Number one is that orange peel appearance, and number two is the relative projection of the chin. Let's start with the orange peel appearance. The orange peel appearance has to do with the action of a muscle. This muscle is called the mentalis muscle. The chin is referred to as the mentum, and the muscle over the chin is called the mentalis muscle. So to address the muscle, the use of a neurotoxin such as Botox or Dysport or Xeomin, you can actually relax that muscle and get that orange peel appearance, referred to in medicine as peau d'orange. You can actually create a very nice improvement. That muscle relaxes and you don't get that dimpling effect. Now, when it comes to projection, you have a few choices. Basically, you have a choice based on one issue, and that has to do with bone projection. Now, without getting unnecessarily overly detailed, the projection of the chin is dependent on basically two factors. One is the relative position of the jaw or the mandible relative to the upper jaw. So if someone has a very strong underbite, the chin can be really further back. Now, sometimes that's an issue that's more of a dental, oral, maxillofacial issue and requires a different kind of correction that has to do with more of a functional issue. So that's something to just be aware of. More typically, it has to do with the genetics of projection of bone structure, where people have what's referred to as a weak chin. So that being said, you have a choice between an implant, like a chin implant, or an injectable filler. I found that in many of my patients, just based on timing alone, they tend to opt for the filler first. They want to see how it'll look, and they like having the convenience of the placement of a filler. In my practice, we do something called structural volumizing, where the filler, such as Juvederm Ultra Plus or Juvederm Voluma, is placed directly on the bone using a very elegant method that's using something called blunt cannulas. Now, that being said, once you get this placed on the bone, you get a very nice, natural-looking projection. Other patients prefer something more definitive. Very often, they feel like rather than getting repeated injections, they'd rather do something more permanent. For them, we perform chin implant surgery. Now, chin implant surgery is one of the most straightforward procedures you can have done. Although it certainly is surgery, but it is a very common surgery in our practice. Basically, through a small opening just under the chin, we're able to put what's called an anatomic implant so that it looks very natural and it just blends with the whole bone structure. Once it's placed, it's there, and it's, as long as it doesn't shift or have any issue with infection, it's there for the duration. And it's very safe, and it works out very, very well. So you have more than a few options, but basically you're differentiating the muscle action that causes the orange peel effect, which needs a neurotoxin, and then the lack of volume that needs some type of augmentation, whether it's a filler or an implant. So I recommend you meet with qualified, experienced cosmetic surgeons. I say surgeons because surgeons will have the option of doing either injectable fillers or implants versus non-surgeons, and then see what you're comfortable with, and then move forward. I think you'll find that enhancing the chin is one of the most satisfying procedures that a person can have. It really balances a person's face significantly, and I think you would like the outcome, whichever path you choose. So I hope that was helpful. I wish you the best of luck, and thank you for your question.